Secondary breast implant surgery really refers to any future surgery after having breast implants in. It might be needed because there's a degree of capsular contracture or thickening and hardening of the scar tissue around the implant. It might be due to a rupture of the implant. There could be other reasons, such as you've got implants in and you've been pregnant and breastfed, or lost weight, or simply the aging process has changed the shape of the breasts and the relationship of the breast to the implant. Finally, it might be due to sizing concerns. You may want to be smaller, you may want to be bigger. If you want to be smaller, we've got to consider whether the breast needs an uplift at the same time, as the relationship of the breast with the implant is really one of the most important factors in deciding about the most appropriate procedure for you. Issues that might need addressing in secondary breast surgery include the waterfall effect, where lax breast tissue has effectively loosened and hung off the end of the implant. It may involve addressing hardened and thickened scar tissue on the inside, capsular contracture. It may involve addressing a ruptured implant or other changes to the breast or implant itself. And the right procedure or combination of procedures can only really be decided for you after careful clinical examination and a discussion with you of what the underlying concerns are and what procedures would be appropriate to address those. Occasionally there may be nothing wrong with the implant itself. It's simply that the breast overlying the implant has got the issues, such as loosening or laxity or a dropped nipple after breastfeeding. And in those cases, occasionally it is possible to leave the implant where it is and perform, for example, a breast lift over that implant. However, in those cases, I would always make sure you're aware that there might be a possibility that we need to change the implant if there's any problem with the implant, if it's encountered during surgery. And therefore, it may affect the costings of the procedure depending on whether we need to use one or two further implants in that procedure. But theoretically, it can be possible sometimes to do a breast procedure over an implant without even needing to see that implant, particularly if we know there's nothing wrong with it. The surgical procedures involved in secondary breast surgery involve operations such as a capsulectomy, removal of the capsule or the scar tissue. This can be quite a time-demanding operation depending on how inherently stuck that scar tissue is within the body. Other procedures commonly used are things such as a mastopexy or breast lift, where we're lifting the breast and lifting the nipple and ensuring a better fit of the skin envelope in the breast around the implant itself. Finally, we may also introduce procedures such as neo-pocket formation. And what that means is if the capsule is thin and not problematic, we can leave the capsule behind. We can stitch it up once we've taken the old implant out, and we can create a new home or new pocket for the implant, either above or below the muscle, above or below the existing capsule, depending on the current situation. So a neo-pocket as well as mastopexy and capsulectomy are common procedures that we may perform in secondary breast surgery. People will often wonder why their prices for secondary breast surgery are often higher than for the first operation. And that's due to the inherent complexity and time-demanding nature of secondary breast surgery. In addition, there's a lot more, in my view, surgical skill that's needed and judgment, with intraoperative decisions and adjustments being made all the time to get you the best possible result that we can. And that is the reason why the cost of secondary breast surgery is usually higher than that of primary breast surgery. The risks of secondary breast surgery are very much reflective of the risks of what we do. So if we are incorporating a mastopexy or breast lift, they are similar to those of any breast lift, whether that is in respect to wound healing, wound breakdown, or blood supply to the nipple. If we're performing capsulectomy, bleeding is a much higher risk factor than it is for a first-time round breast augmentation. And that's something that we've got to factor in with how we're doing the operations and whether we might consider using drains in certain circumstances in that sort of situation.